Hello, everyone. It's another Fraud Watch Friday. We are glad to be back with more fraud tips for you. And today we've got a really important topic, and it's Medicare fraud. And you may think, well, that's a big topic. It doesn't really affect me. There's nothing I can do about it. That is not true. One of the aspects of Medicare fraud that can really touch you as an individual is the theft of your personal medical information. And so we're going to get into that. Also, the fact that it's a multi-billion-dollar fraud that costs us all our tax dollars. And as always, to help me with that, I've got a couple of our great volunteers joining me. Hello, Jean. Hello, Pat.
Hi there. Hello.
Good to see you both. How are things with you?
Going well.
Well, it's hard to believe summer's over. You know, once we hit Labor Day back to school, I feel, oh, summer's over.
We've got another month of summer weather, though, I think.
Yeah,
it isn't entirely over. I actually like the little cooler weather myself. Being a native Seattleite, when it gets over 70 degrees, I start to wilt. So
I agree.
this is actually good for me. But our topic today is Medicare fraud. Is there anything you want to say up front before we get started?
Well, I think the important thing to know is that there are so many millions of people on Medicare, and that scammers are aware. If you're over 65, you are probably on Medicare, and it is a really hot scam across the country. It's something for which we're all at risk.
All right. Well, let's get into it then. Pat, I think you are going to be starting us off. Is that correct?
I am.
And we've got a presentation that's going to run down the subject very briefly and then tell you what you can do to protect yourself from being victimized. So I'm going to take myself out. Pat is going to take us away, and I'll see you guys at the end of the presentation.
Thanks, Bruce.
So for several years, the top two complaints Washington state residents have made to the FTC are imposter scams and identity theft, as you see on your screen. With both, a common theme is Medicare fraud. Medicare fraud and abuse are big business. It is estimated to cost the United States about $50 billion a year or $1 billion a week. Individuals claiming to be with Medicare contact victims and ask for Medicare numbers, bank account, and credit card information. They say that you need to pay for a service or a new Medicare card, or there's a problem with your Medicare claim, and they need to confirm your number. It is important to know that Medicare will never call you out of the blue to request this information. If you are concerned, you can call Medicare yourself to investigate. They have a number that's very easy to remember. It's 1-800-MEDICARE. Try not to be fooled if a caller ID or email address looks authentic. Remember, scammers are smart. They will spoof their contact information to fool you into thinking that they're legitimate. Medical identity theft is a special type of identity theft when someone uses your Medicare or Medicaid number to submit fraudulent claims. Medical identity theft can result in false or misdiagnosis, treatment for conditions you don't have, incorrect lab results, bills for services you didn't get, denied services or prescriptions, and inaccurate medical history records. So there was a story on 60 Minutes a few years ago regarding a fellow whose medical record showed that he had received 2 prosthetic legs through Medicare. This was not true. Evidently, someone used his Medicare number, and the amount of misinformation in his medical records following the other person's surgery was mind-boggling. So let's do what we can to prevent Medicare fraud. Jean?
One of the most important things that we can do as individuals is to protect our Medicare card and number. In past years, when meeting with a group of people live, we would often say, how many people here are carrying their Social Security cards? Well, everyone recognized that that was not safe. And so almost no hands would go up in the room. But when I asked how many people are carrying a Medicare card, almost every hand went up, because I think people believe that it's better to carry your Medicare card around with you. But as we can see on the slide, a Medicare number is as valuable to identity thieves as to a credit card. So please do everything you can to protect your credit card, protect your Medicare card and number. Although our cards no longer have our Social Security numbers, they're still valuable to criminals because, as Pat just told us a few moments ago, the number can be used by someone who wants to get medical treatment, and they will use our Medicare name and number to have this happen. You may think you need to carry your Medicare card in case you're going to be in an accident, or maybe just for security, you want to have it on your person. Well, you don't really need to do that. Here's what is recommended. It's recommended that you make a copy of your Medicare card, and on the copy, you are going to cross off your Medicare number so that it is illegible. Leave the rest of the information on the card, on the copy, and then carry the copy in your wallet. Put the original in a safe place at home, and you can retrieve it when you have a scheduled doctor's appointment. If you should be in an accident or unexpectedly need to have medical care, if you have the copy in your wallet, whoever picks you up, the ambulance drivers, the hospital, whatever, they will be aware that you have Medicare, your name is on there, the date that your Medicare was started. And so you will be able to receive care. Believe me, they will find you in the Medicare computers. Now, if you're someone who's enrolled in a Medicare Advantage plan, the card you're more likely to carry will be the card related to that plan. That also can be used for Medicare fraud. It's not used as frequently as the original Medicare card is, but be really cautious with that too. The important thing to remember, never ever share your information with someone who contacts you, because your plan will not call you to ask for your number, and Medicare certainly will never call you to ask for your number. We're going to return now to Pat.
So on the next slide, we'll talk about reviewing your MSN or EOB. So even when you do everything right, there's a chance that you could be a target of healthcare fraud or abuse. Medicare abuse occurs when Medicare is billed for services you did not receive. And there's many ways that your personal information can be used without your permission. So what can you do to be on the lookout for Medicare fraud? Always review your medical summary notice, known as your MSN, and your explanation of benefits, known as EOB, for mistakes. Your forms will look different from the one on the slide, but the information will be similar. This information is shared by the Senior Medicare Patrol, a national program that works with Medicare beneficiaries to prevent and report Medicare fraud. First, the Medicare summary notice. So this is a statement sent every 3 months to people who have original Medicare. Across the top is the statement, "This is not a bill." It lists all services and supplies billed to Medicare in your name over the past 3 months. The statement indicates the service delivered, the amount paid, and any balance you owe the provider. Next, the explanation of benefits. You'll receive this if you're enrolled in a Medicare Advantage plan or a Medicare Part D prescription drug plan. These are normally sent out monthly. There are 3 things to look for on your billing statements: charges for something you didn't receive, billing for the same thing twice, and services that were not ordered by your doctor. If you have a question, contact your doctor's office. Sometimes errors are just a simple mistake in coding, but sometimes they alert you to fraud or abuse. You want to make certain charges applied to your Medicare account are accurate. Jean?
Thanks, Pat. One of the ways that Medicare has seen a huge increase in scams related to Medicare services has been since the pandemic began. And one thing we know is that scammers frequently follow the headlines, and that's what's happening with the COVID scam too. So right now we're a little confused. We don't know, is Medicare covering COVID tests? Are they covering test kits? We're just not sure. Well, one thing that we can do always is to make sure that our information is current. We can go to the Medicare.gov website and we can look it up. We can find out what is happening in terms of Medicare funding for tests and for other COVID-related services. So right now, it is still happening that Medicare will cover up to 8 over-the-counter COVID-19 test kits per month at no cost to you. There has been confusion about this, so I just want to clarify that's the case as of today. You'll want to check in the future with Medicare.gov. These tests are covered by Medicare Part B. If you are someone who does not have Medicare Part B, if all you have is Part A, Medicare will not fund it, but you may be able to get funding for the test kits through other insurance or through services available through your medical provider. If you're in a Medicare Advantage plan, and typically that's how you get your Medicare services paid for, Medicare B is still the source that will pay for these test kits. You might need to show your red, white, and blue Medicare card, even if you have a Medicare Advantage plan, in order to access the kits, and these are available at participating pharmacies. If you are someone who goes to a source for kits or tests, and these are not paid for automatically by Medicare, please retain the box so that you will have a receipt and a way for Medicare to track, and you will be able to get reimbursed, hopefully in most cases. Again, you can get the covered tests at participating pharmacies or healthcare providers at no cost to you, even if you're not a current customer or patient, but you may need to show your Medicare card. Other things, though, that can come up in the future regarding Medicare, and this is happening right now with new legislation that's being passed just within the last few weeks. It's being announced that Medicare is going to cover hearing aids, that some forms of medication and shingle shots and all that are going to be covered by Medicare to a greater extent than has happened in the past. Again, the information is incomplete. It's still coming out. Some things are taking effect next year, some things in 2024, some things in 2025. And so you just want to be cautious. You don't want someone to contact you, giving you false information, and as a result, winning your confidence and getting your Medicare information. So please be very cautious. If you go online, there are copycat websites. Make sure that you go someplace legitimate. Go to Medicare.gov, or here, if you are a victim of COVID fraud, you can report it at the ftc.gov. And now we'll turn it back to Pat.
So next, we should talk about prevention strategies. Protect yourself and your loved ones from Medicare fraud and abuse. In addition to what we shared earlier, here are some important tips. Discourage mail theft by using a locking mailbox. Shred statements and notices that contain your Medicare information before you throw them away. Be aware that Medicare doesn't call or visit to sell you anything. Keep in mind that you may hear from a person with whom you have insurance, but you don't have to talk to anyone who calls you or shows up at your door who you don't trust. Legitimate reps will understand. And you can call them back using the number on the back of your insurance card, a number that you know is correct. Sales reps and agents for Medicare Advantage and other insurance plans that you don't have a contract with are not permitted to cold call. It is against the law. They can only respond to your request for information. Plus, scammers can easily misrepresent themselves as sales reps, as we learned in the first slide that described imposter fraud. And be cautious of offers for free medical services. Remember, if it sounds too good to be true, it probably is. Remember those late night advertisements you may have seen for free electric scooters? Or the ads running now advising you can get a slew of free extra benefits? Be sure to read the fine print. They probably aren't free. And pass it on. Share this information with family and friends who might not already know how to prevent Medicare fraud and abuse. Jean?
Thank you, Pat. And now we just have one final bit of advice: where to go if you have a question about whether you have been approached and maybe you were tempted, or maybe, unfortunately, you might have even fallen for a scam. So where can you go? Where can you go for some help and get some honest information? So we recommend, if anyone has become a victim of fraud or you're not sure if you are, please call our Fraud Watch helpline, and the number is listed there, 877-908-3360. We have trained volunteers, and they are at 2 locations. One of them is right here in Washington State, and there are volunteers. There's just an army of folks across the country who are doing what they can to help keep us all safe. Specific to Medicare, we're also including the number for the Senior Medicare Patrol. And this number will tie you into the Office of the Insurance Commissioner here in Washington State. These are also trained volunteers. Their whole reason for being is to help prevent fraud, and they can address any sorts of scam that you are experiencing related to fraud. I also want to mention, if you have shared bank account information, if you feel that you really fell for it and now you think you're afraid that maybe your information is in jeopardy, please contact your bank or the institution whose information you shared. You may need to put a fraud alert on your credit reports. Again, all of that information, though, can be shared with you at our Fraud Watch helpline. These are folks who have assisted really thousands and thousands of people across the country, and I know that they will be able to help you with any questions regarding Medicare fraud. Also, we have free watchdog alerts at aarp.org/fraud. And if you happen to go to the AARP fraud prevention website, you will see that there is a map, and you can click on Washington State, and you will see the types of scams that our neighbors are experiencing. It will give you a heads up about the kinds of things we need to be concerned about. And always up there at the top of the list is Medicare fraud. And now Bruce is going to wrap it up and bring us home.
Well, thank you very much, Jean and Pat. That's really interesting information. I admit I don't know a lot about Medicare since I'm not quite there yet, but it's such a big topic, and I think people are very easily confused. I know when COVID tests come out, some are free, some are paid for. You can go to this website, you can call this number. It's just so confusing. So I really appreciate the information that you've researched and brought forward to us. And so I think the thing I would also like to emphasize is our fraud helpline. You mentioned the number. I'm going to put the number up again because we have trained volunteers who will not answer your questions about Medicare insurance or your benefits or anything, but anything to do with fraud. We have trained people who answer those phones, who can help you with that, and not just Medicare fraud, all sorts of fraud. So if you have a question about something that you may have been approached about, or if you want advice on helping a loved one, if you want to check out if something sounds fishy or is too good to be true, as we always say, you can call that number. Also, we mentioned our fraud website, and there is a wealth of information there. It used to be arp.org/fraudwatchnetwork. Now we've upgraded it. It's only fraud, but it'll take you to that same place. It's got all the information that we have on all kinds of fraud, and it's always growing. And the last thing that I would present to you is we have speakers. We have a speakers bureau, rather, and it features speakers like Jean and Pat giving various presentations. We have a general fraud presentation that covers all sorts of frauds, not in the level of detail that we've talked about today, but it's more of a general fraud presentation, runs about an hour. And that is available for free to your groups, whether church groups, alumni groups, neighborhood groups. and any sort of group that you think would benefit from fraud information from our trained volunteers who really know the subject, you can find information about that at aarp.org/WA Speakers Hub, WA Speakers Hub. And there's a link there to connect you to request a presentation. I think with that, are there any closing thoughts, Jean and Pat, that you have on this subject?
Well, just that we hope that we've helped people by giving them a bunch of information that'll protect them from fraud.
Mm-hmm. And also that will help to protect the Medicare trust fund, as they call it, the funds, because this is huge. And a lot of the fraud that's committed ends up sending money overseas. And not only overseas, I mean, there have been quite a few scammers that have been caught here in the United States as well, millions and millions of dollars, because they put in claims in other people's names so that they delivered services that they didn't. And we just all have to do our part, I think, to help keep things safe.
Yeah, there's always talk about waste, fraud, and abuse. That's a problem in Medicare. But each of us can do our little part to try and make a dent in that. So it is important that we all do our part, I guess. But, I was also struck by the amount of information that Medicare has. If that gets out, I thought when you mentioned the history of surgeries that you never had or medications, that you're not on, that's a real life-threatening thing potentially. It's incumbent on all of us to try and clean that up. We are doing our Fraud Watch Friday next week. It's our Q&A session with our cyber expert, Dave Morrow. He'll be back to answer your questions about anything cyber-related, tech-related that you can do to protect yourself from fraud. If you have questions about email and scam emails and texts and, securing your home router or your phone, come back at 10:30 a.m. Friday. We'll be live here on Facebook answering your questions. So with that, is there anything else you guys want to leave us with?
Ooh, this is a tricky one because, of course, we hope everyone will be safe from fraud, because too often, I always say sometimes there's no cure, right? The best thing is prevention. And hopefully we've given people the tools today that will help prevent them from becoming a victim. And that is certainly going to answer our prayers.
Yes, definitely.
All right. Well, thank you again. Our volunteer fraud fighters are what make this program go. So thank you. We depend on you. And I'm going to put up our closing slide. It's got the Fraud Watch call center number and the website. So if you missed those, you have one more chance to get them. And we'll see you back here next week, Friday at 10:30. Thanks, everyone.
Thank you.
Thank you.